tests that we do are termed epigenetic tests. Okay, so that determines the function of that individual now. So we utilise blood, we utilise urine, we utilise saliva, we utilise bioimpedance, and all those things give us a different perspective on the body. The live blood analysis gives us an idea of real-time what your blood is doing, and blood is connective tissue. It gives you an instantaneous representation of the body's function, or not, what it's doing. Okay. The urine and saliva gives an idea of your pHs, whether you're too alkaline or too acidic, what sort of levels of toxins you're carrying, what's your total blood sugar load like. We look at leaky gut. If you have a leaky gut, you're allowing partially digested proteins and other substances into the blood, which then can cause problems. And partially digested gluten from wheat can cause 40-odd different disease processes, and most of them autoimmune in nature. Okay. So again, we see you wander off to the GP with a multiple sclerosis or SLE or some other rheumatoid arthritis, and you get an anti-inflammatory, or you get a steroid, or you get this or that. No one ever talks about the gut. You fix the gut, that protein doesn't get into the blood and doesn't cause a problem. Through the test, we're looking at your baselines, or the fundamentals of your biochemistry. What does your body require, and in what certain parameters does it have to operate within for best function? Okay, so are you intracellularly dehydrated? If you don't have minerals to set up osmotic gradients, you have water leaking out of the cell from inside to outside, and you become intracellularly dehydrated. Water is a universal solvent. All your biochemistry takes place in a water medium. If there's not enough water inside your cell, the cell can't function properly. And whatever role it's playing can't do what it's supposed to be doing. Okay. So unless you address that, you can play with whatever else you like. It's not going to make any difference. You're not going to get a result until you ensure that the body has water where it needs to be. Okay. If your pHs are too far out, if you're too alkaline or too acidic, the body is simply unable to absorb minerals across the membranes. Can't do it. If you don't have enough salt, you don't have chloride molecules, you don't have what's required to draw these other molecules across the membrane. The liver doesn't get what it needs, it can't do what it needs to do. If you can't produce hydrochloric acid, you can't set up the whole digestive cascade. So it's all about getting the basics in place that allows, well, it clears the picture. You know, we see people, we come up with a list of 30 things. And so where are you going to start on that list? So we'll start with the basics. You get the basics right, a couple of weeks, half of those things are gone. Another couple of weeks, most of them are gone, and there'll be something that's sitting there glaringly obvious, and you can target that specifically. And we do that through the testing. It allows you to focus and hone in on what is required for that individual. It takes the guesswork out of things.